When US President Franklin Roosevelt died of hemorrhagic stroke in 1945, his blood pressure was astounding more than 300 systolic and around 200 diastolic. So nobody knew you that time as how to treat this high blood pressure. So that was last century. But in this modern era, we have various inexpensive but at the same time safe and efficacious drugs. But in spite of all those, in today's world, most of us, our blood pressure doesn't remain in control because of various misconceptions regarding high blood pressure and our faulty lifestyles. In today's video, I'll discuss about the various misconceptions regarding high blood pressure so that you get a proper idea about how to manage your blood pressure so that it prevents from various life-threatening complications. So what is high blood pressure? The definition wise, most of the time the definition says if the systolic blood pressure or the higher blood pressure is more than or equal to 140 and the lower or diastolic blood pressure is 90 or more than that, it is high blood pressure or hypertension. High blood pressure or hypertension is actually the tip of the iceberg. The number of person we diagnose hypertension or high blood pressure is much less compared to the number of person who are having a high blood pressure who are roaming around in the community. So hypertension rate in India, as I have shown in this chart, are actually quite dismal. If 100 people are having hypertension or high blood pressure, only 1/4, 25 to 27% are detected to have hypertension, are aware to having hypertension. And even more dismal is the fact is that out of these 25 people who are aware of hypertension, only 50, almost around 50% are taking treatment. And even worse statistics is that those who are taking treatment also, hardly 10% is having an adequately controlled hypertension. So that is the dismal statistics of hypertension or high blood pressure in India. So having said that, this chart shows that compared to various other countries, Western countries and US and Canada, the blood pressure awareness, the blood pressure treatment and blood pressure control in India is quite dismal. So if you like our channel, kindly subscribe our channel and share it to somebody else. As a practicing cardiologist, I bring out practical, science-backed health-related topics so that it augments your health and wellness. So why worry about high blood pressure? Because if high blood pressure is not treated, long-term high blood pressure can lead on to various complications. Like it can cause central nervous system, brain complication like stroke, or it can lead on to brain hemorrhage. In the eye, it can lead on to blindness. In the heart, it can cause heart failure or heart blockages. In the kidneys, it can cause renal failure. In the blood vessels, it can cause blockages. So various complications of high BP, uncontrolled BPs are there. So that's why you need to be worried about high blood pressure. But the common myth is there, I do not have any symptom. Why do I need to check for blood pressure? But the fact of the matter is that even if you do not have symptom, you need to check periodically for high blood pressure because high blood pressure is by and large asymptomatic or silent. It won't cause any symptoms. So unless you check for blood pressure won't remain diagnosed or detected and it could be dangerous as we have discussed previously. Another misconception which commonly arises and very commonly patients ask to me is that, doctor, I am having high blood pressure. I am taking medications for high blood pressure, but at present my blood pressure is 110/60. Is it too low? Am I having hypotension? Should I discontinue my blood pressure medicines? The answer is that 110/60 is an optimal blood pressure. You ideally should have blood pressure around that range. Unless and until your blood pressure comes below 100 or you are having symptoms of hypotension like giddiness or blurring of vision or profound fatigability, you should not discontinue the blood pressure medications. You should consult with your doctor because if you suddenly discontinue your medication, sometime it can lead on to dangerous fluctuation of blood pressure and it can lead on to various complications. So 110/60 is not a low BP, is a normal BP and you are having 110/60 because you are taking antihypertensive or blood pressure medication. Another misconception is there, patients tell that because of BP my blood pressure has become 110/60. If I continue the blood pressure medicine, will it decrease it further? The answer is no. The blood pressure medication, it has maintained your blood pressure to normal and if you continue the medicine also, it will maintain the blood pressure in that range. So unless and until you are having symptoms like excessive giddiness or blurring of vision or excessive fatigability, in that scenario, you should consult your doctor. Then you probably need to change the dose of the medication. Otherwise, by looking only at the number, if it is 110 by 60 or 120 by 70, need not be worried. You should continue with your medication. Because as I have shown in this chart, various studies have shown that once your blood pressure crosses below more than 115 systolic and more than 75 diastolic, each 20 millimeter increase in systolic blood pressure and each 10 millimeter increase in diastolic blood pressure increases the risk of heart attack or stroke by twofold. I'll give you an example. So suppose your blood pressure is 115, the systolic BP, and 75 is the diastolic BP. So 115, if you increase by 20, it becomes 135, and diastolic, if you increase by 10, it becomes 85. From 75 to 85, from 115 to 135. So each 10 millimeter increase in the diastolic BP or each 20 millimeter increase in systolic BP increases the risk of stroke or heart attack. So from 115 to 135 systolic BP increase the risk of heart attack by twofold. If it further increases from systolic 135 to 155 and diastolic 85 to 95, it increases the risk of heart attack and stroke by fourfold, another twofold increase. If it increases further from systolic BP 155 to 175 and diastolic BP 85 to 95, then it increases the risk of heart attack or stroke by another twofold. So it increases by every twofold, by 20 millimeter increase in systolic blood pressure and 10 millimeter increase in diastolic blood pressure from the level of 115 systolic and 75 diastolic. So that means we should have a very tight control of BP around 110 by 60, 120 by 70, in that range, so that it prevents a complication of heart attack and stroke. So if you like our content, you can see our prior video which talks about how to measure the blood pressure correctly at home. And thank you all for your patience.